Welcome to Therapy Explained, where we explain, demystify, and destigmatize mental health and mental health treatment. My name is Deniss. I'm a licensed therapist, group practice owner, and mental health advocate and speaker, and of course, your host here at Therapy Explained. Online or virtual therapy has actually been around for a pretty long time, even before the pandemic. But the lockdowns are what made online therapy even more popular, as there was a rapid increase in mental health services, but of course a very steep decline in access to in-person mental health support. So now online therapy is actually very common and very accessible from most therapists. They will offer an in-person or an online therapy choice, which is great. Accessibility is amazing. It can be even a little bit more convenient, but there are some things that we need to take into account when making that decision that you might not really think of as you're trying to decide whether or not you want to do in-person or virtual. So let's talk about some of those pros and some of the cons to online therapy. But of course, before we jump into that conversation, just a quick reminder, as always, to subscribe to the channel if you haven't already. And if you find the video useful at any point, be sure to give it a thumbs up. Let's get on the same page as always. What is virtual or online therapy? Online or virtual therapy is technically known as telehealth or telemedicine. These are the terms that some therapists and insurances will use in order to talk about this type of therapy. It means that you will more than likely be logging on to an online video platform in order to be able to have your therapy. Ideally and legally, this should also be a HIPAA compliant platform. For any of you who might not be familiar with what HIPAA is, here is a quote from the CDC that describes what HIPAA is. HIPAA is a 1996 federal law that requires the creation of national standards to protect sensitive patient health information from being disclosed without your consent or knowledge. Essentially, what this means is a law that has certain requirements for therapists and anybody else providing medical services, particularly of confidentiality and privacy. So while you're not required to know every detail of what this might actually be, it might be a very good question to just ask of your therapist, are you using a HIPAA compliant platform as you're shopping around and doing your consultations? Your online therapy should also be comprised of a video and a voice element so that your therapist can see you just as much as they can hear you. This means that at the very least, they can read your facial expressions and assess for any sort of safety issues or concerns that might arise as you're going through therapy. Let's talk about effectiveness of online or virtual therapy. The good news is that studies show virtual or online therapy can be just as effective as in-person therapy for individuals. So we do have pretty significant research for individual therapy. So that means if you're shopping around for a therapist for individual therapy, most of your decision will come down to what is most convenient for you, what makes the most sense for you, and really just preference. The research is there for this type of therapy, but not so much for couples or family therapy. So let's jump into the pros. Of course, number one, convenience. Being able to access your therapy through your phone, tablet, or computer. This also means that you don't have to drive to and from a therapist's office, which means you're significantly cutting down the amount of time that you're spending in your car traveling from place to place. It also increases the pool of therapists that you can choose from. As long as your therapist is licensed in your state, they can actually live anywhere. This means that if you live in a rural area where there might not be a therapist within drivable distance, you can now see a therapist anywhere in your state. This also means sometimes that you might be able to have a therapist who lives in Northern California or living in Southern California, or maybe a therapist who's in New York while you live in California, as long as they are licensed in your state. This is awesome because it increases access to mental health in general, but also your choice to pick a therapist that you actually feel comfortable and safe with, which goes a very long way when we're talking about progress and process in therapy. Accessibility is another big pro. Patients with mobility issues or restrictions are not able to also access the mental health and support that they need directly from the comfort of their home or wherever they are at and is most convenient for them. And comfort. You might actually feel more comfortable processing difficult things in your room, in your bedroom, in your couch, in a place where you actually feel safe. So as you can see, online therapy has many benefits to it. On top of the fact that being able to have therapy and the process of therapy can be very beneficial within itself. But let's talk about some of the things that you should keep in mind as you're making this decision and where there are some areas in which online therapy might actually be contraindicated. Limited access. I know we just talked about how accessible it might be to be able to have therapy through your phone or your computer or your tablet, but that also assumes that you have a phone, computer, or tablet. Technology-wise, these things can be pretty expensive and not everybody has access to this, which means that they will not be able to access online therapy. Similarly, it's important to be able to have access to reliable internet. If your internet keeps cutting off as you're trying to process some things, it might mean that online therapy might not be the best option for you. Again, this is also us assuming that you have access to internet, that you can either pay for it or pay for a certain amount of it that is actually reliable. Confidentiality and privacy is another limit to online therapy. First of all, even if your therapist is meeting all of the requirements from HIPAA, we actually are not able to protect your confidentiality on your side of the screen. If you don't live alone or are taking your therapy in a public space, which we probably would discourage you from as a therapist anyway, but if you choose to do that and you have no other option, that might actually be a con. Your privacy is not protected and it means that anybody can listen to your conversation, or at least your side of the conversation. So if you're considering online or virtual therapy, it's important for you to ask yourself, do I have access to a safe, quiet space where I can do my therapy, and do I have the technology needed to do that? Both a device to do my therapy through, but also access to reliable internet to do that. Online therapy might also limit the amount of information that your therapist is able to gather from you. One of the things that we look at throughout therapy is how your body is responding to the things that you're talking about. Even if you're not working with a somatic therapist or a therapist that does body-centered interventions, your therapist will either way still try to pay attention to how your whole body is responding. And because we can only see from the shoulders or the neck up, we're not really going to be able to see if you're shifting a lot or if you're shaking your leg or your foot, and then we won't have access to that information. You might also be twiddling your thumbs a lot when we won't know. While this information isn't extremely crucial to the therapy process, it does mean that some of that information kind of goes away. Some people who are very observant can also be able to tell if you're moving your arms because your shoulders are moving, or a therapist, who does online therapy a lot might actually just prompt you to pause for a second and ask how your body is responding to something if they have a feeling that your body might be having a response. It might also limit the kind of interventions that your therapist is able to do with you. If a therapist likes to do meditation, for example, it might be useful to have access to things like essential oils or candles or a certain type of maybe like sensory tool. And it doesn't mean that you can't go shopping for these things and go get them yourself for the next time that you see your therapist, or for a point in which you can use them with your therapist. But this then adds an extra burden of finance for you and time and effort to have to get these things. In a therapy room, your therapist will just have everything that they need in order to be able to do some of these interventions with you in the room. But since you're not with them there, you're going to have to buy or purchase these things on your own, or altogether just not do some of these things. Of course, a therapist will be able to adjust their interventions to make them more convenient and more accessible for you through online therapy, but this is a piece that you might have to miss out on. Similarly, if a therapist is doing something that requires a specified or specific kind of material for their therapy, certain types of therapies will require actual almost medical grade supplies and things that they'll need that you might not even have access to purchase. So those kinds of therapies just wouldn't work for online therapy. And of course, I'm sure that if that is the case, a therapist wouldn't offer you that kind of therapy to begin with, but then that means that kind of therapy is not for online and you would have to switch to in-person if that's something that you would like to do. And online therapy is actually contraindicated for certain types of chronic and severe psychiatric diagnoses. So it is important for you to talk to your doctor, psychiatrist, therapist, and anybody else who's involved in your care in order to make the best decision for yourself. Online therapy has increased access to mental health services so much, and there are so many pros to being able to just even access therapy in general. But I do encourage you to keep in mind some of these cons and figure out if these cons are big enough for you to decide, okay, in-person therapy might be better for me. I also have faith that most therapists will let you know during the consultation period if your symptoms or the type of therapy that they think might be best for you will not be best online and would encourage you to do in therapy. Most therapists will do that. That's why consultations are so important. If you need some help figuring out what to expect during a consultation or what questions to ask during a consultation, I encourage you to check out some of my other videos on that if you're currently in that journey. And if you are wondering more about where you can start that journey, you can download my free resource list. It's available through my website where there are other resources available for you to be able to purchase, from healthy communication guides to an affirmation deck. Those are available for you in the same space. But of course, the resource guide is completely free, and it does include my favorite directories, books, and other mental health related resources. I hope that you found today's video helpful. If you did, remember to give it a thumbs up and subscribe to the channel if you haven't already. Thank you so much for watching today's video, and I will see you in the next one.